Thank you, Madam Minister, Ministry of Health, and everyone who's here today. Thank you for the invitation and chance to speak. My background is in tobacco taxation, taxation in general and modeling, and tobacco taxation the last 6 to 8 years. I would say regulatory measures and health prevention, do they work? The short answer is yes. They're not all the same, but it does work, and I'm going to talk more about the package of reforms and measures in tobacco today, because that's global and a lot of countries involved. There's support for a package of interventions like Dr. Sassi mentioned for obesity, and then we'll talk some about what's happening more recently in sugar taxes, less on alcohol taxes. So we know the problem. It's the huge numbers of deaths due to non-communicable diseases. In 2015, it was almost 40 million out of a total of 56 million deaths globally, and almost half of these are with people under 70 years old, which in the rich world is premature, not necessarily in Africa and some others, but more than 80% of these diseases are accounted by 4 diseases: cardiovascular, cancers, respiratory diseases, and diabetes. By type, we know that 7 million people are dying a year now from tobacco and use and secondhand smoke. Huge number. But another 7 million are between the harmful use of alcohol and diabetes and obesity and overweight. So those two are now equal to the numbers dying from tobacco use. So I'll talk a little bit about regulatory measures, the WHO Framework Convention on Tobacco Control, and the measures, this kind of set of measures used to work on this area. A little bit on other health taxes, alcohol, sugar sweetened, and some examples, and then very briefly on we're seeing more and more of some of the increased use of increased taxes for health, various aspects of health, tobacco control or other. So the WHO Framework Convention on Tobacco Control was adopted in 2003. It is the only treaty that WHO has been involved with. It has been ratified or acceded to now by 181 parties. We have some, like the EU, as a separate party than member states. That's much of the world. Unfortunately, my country, the US, is not. It is signed, but it is not acceded to. A few other large countries like Indonesia is also not involved. Morocco is the most recent to join last year. So it's global. 181 parties is a lot of the world. Its purpose is to protect future generations from the health, social, environmental, economic consequences of tobacco consumption and those who are around people who consume tobacco. Since it's a treaty, it's an obligation. When countries join the FCTC, they commit to certain things, which is mainly developing, implementing a multi-sector comprehensive plan for dealing with tobacco control. And that's a lot of what we do, is work with countries, trying to work on these plans, coming up with a strategy and implementing. WHO, which is separate from the FCTC Secretariat, is housed in WHO, but it is a separate entity. There is a package of measures which has the cute acronym EMPOWER. It's what we've been working. We've gotten a lot of funding from Bloomberg Foundation and also from the Gates Foundation for work in Africa. First one, monitor tobacco use and prevention. If we aren't able to see what is happening, what the interventions work, which ones don't, then we're not going to be able to know what to do going forward. Protect people from tobacco smoke, smoke-free areas. I remember the first time I went into a pub in Seattle, Washington. I've been living in Europe in the Balkans for many years, and everyone still smokes there everywhere. Went into a pub, and there was nobody smoking. And it was amazing that it could actually be a pleasant experience. It seems in many countries, we're used to it now, but it was a big deal, and it's still will hopefully be a big deal in more parts of the world. Offer help to quit, cessation. That's weakest in poor countries because they don't have medical systems that are strong enough. But that's also very important if someone wants to quit, that we can help them quit. Warn about the dangers. This means both the package warnings and the mass media campaigns. Enforce bans on tobacco advertising, promotion, and sponsorship. It was relatively easy for advertising, although the country Georgia has just finally banned that, just recently. Sponsorship can be tricky because it can be used as part of corporate social responsibility. It seems like it's a nice thing. It's Philip Morris is promoting sports for youth, but it's still advertising for Philip Morris and it still should not be allowed. And finally, my main area, raise taxes. And what we have found is the whole package is very important. If we have to pick one single measure that will affect consumption, it would be taxes. Taxes raised enough to increase prices. But again, it works better with the whole package. This is kind of hard to read, I apologize. It's comparing the different Empower measures between 2014 and then the blue is 2016. This is a proportion of the world's population covered by each of these. And it's actually kind of sad. After all those years and efforts, the only one that reaches 50% of the world's populations that are covered is, I think that is mass media. A little hard to read here. Yeah. We had the biggest improvements between 2014 and 2016 in cessation and warning labels. As you probably know, there's been a whole movement towards plain packaging, which means the same kind of color and package for all cigarettes with just the brand, no extra advertising on the brand, and then large health pictures. So that has improved. The tax, the one single that works the best, method that works the best, no change, only 10%. That doesn't mean only 10% have taxes, but have taxes high enough to make a difference in consumption. As I said, we have seen in many countries that large increases in taxes, enough to increase prices, is the single most consistently effective tool for reducing tobacco use. And of course, then the subsequent decrease in premature deaths and better health for those who quit smoking. We call it a win-win. Tobacco tax is a win for public revenues, and it's a win for public health. Oh, that's interesting. Okay, tobacco is different from other kinds of goods because it is addictive and it is harmful to everyone who uses it in any amount. There is no safe level of smoking or tobacco use. So it's different in that. It's like guns. There is no, well, actually it's worse than guns because you can't even go target practicing. Sorry, I'm American, so this is a sore subject for me. But it is the same as all other goods, most other goods, in that it does respond to price. If cigarettes get more expensive, some people will quit, some people will smoke less. People who have quit will be less likely to go back to smoking. And to me, what is the most important is that youth are more responsive and fewer young people will start smoking. Because if young people don't start smoking, then they're likely to be smoke-free their whole life. It's very important. And the industry knows this. That's why they are pushing very hard in Africa. Africa has very low incidence in general, but they're a young population and incomes are rising. So it's a perfect target for the tobacco companies, and you can see them working hard. So that one is extremely important. So alcohol and sugar-sweetened beverages are similar to tobacco, especially the harmful use of alcohol. The difference is that they're not necessarily unhealthy in moderate or small doses. You can argue on that one. The one thing we do know, though, they also do respond to price, and we're seeing that with some of the more recent increases in taxes or introduction of taxes, and for especially sugar-sweetened beverages. This is a graphic I wanted to show. It's most sold brands, so it's not the average. What we should be using, what the EU uses now, is an average sales price. But this is, WHO does it every 2 years, the Global Tobacco Survey, and we have comparable data. The red bars are the tax rates, the green is the sales price, and then we see the blue is consumption or sales, and the yellow is revenue. Now, you could say that France is a mature market. They have high prices already. We don't see the part of the graph when they originally were increasing quite a bit, and you see more dramatic increase. But we can also see there's 4 or 5 years where the taxes didn't change, and neither did consumption. There is the same, if we do increase taxes enough to increase prices, we will see a drop in demand in virtually every country. France, by the way, is increasing. It will start this year. It started increasing again. This one is US data because we had a nice long data series. The red is consumption, cigarette consumption, and the blue is deaths from lung cancer. And we actually have data going back even earlier. You can see it's exact. Peaks somewhere in the mid-60s for cigarette consumption. Around 30 years later, we see lung cancer deaths peaking and coming down. It's nice because we do have the long enough to see how clear that relationship is. I'm going to go through the EU example. Actually, maybe I'll just skip through it because I'm an economist, interesting to me, but we don't really need to go into tax rates. Just to say that the type of system of tax rates does matter for decreasing consumption. If it's just a percentage of a low base, like in much of Africa, it's a percentage of the import or factory price, which is lower. And so it tends to, 100% tax rate isn't really very much tax if you're talking just about the import, not the retail, but the wholesale import of cigarettes. Having a single amount basically makes a minimum floor. A minimum price or tax can do the same thing. And we have all of those elements. It's a mixed system in Europe. It's specific, which means an amount per pack or per thousand, and an ad valorem percentage of the retail price. There's also a minimum tax in euros, 90 euros now per thousand, and or 60% of the weighted average price. It has both been able to increase taxes and harmonize to a certain extent, harmonize the bottom. You still have some companies that want higher taxes, which is fine, but it's brought up the bottom of minimum prices in tobacco products. This is 2016, looking at the Euro area. These are WHO areas versus the rest of the world, and the highest percentage of tax in the retail price is in the Euro area. It would be more like 80% if it were just the EU, but this includes former Soviet Union and former Yugoslavia. So that's why it keeps it down to about 66%. You can see the red, again, is tax. It's the lowest in Africa, which we would expect. It's not the lowest price, but the lowest tax. There's some controversy on how much is recommended, 75% of the retail price, total tax, or 70% just excise tax for tobacco. But really, as regions, probably the EU is the only area that is consistently hits that target. US, some states, but we have a federal tobacco tax, but also states. And so California and New York, for example, have very high rates. In the EU, it's Britain and Ireland that have the highest. So I'm going to skip that. That's just showing over the years of the introduction of the harmonized system. Okay, very quickly and very generally. This is a map that just kind of gives us an idea on alcohol taxes. The light pink are countries that tax all three: beer, wine, and spirits. That would be most countries. The black is, let's see, the black is no tax. There's only a few. There's a few that ban alcohol altogether. It's all over the map, though, because even in the ones countries that tax all three major types of alcohol, it's cultural and depends on what's produced there. It can be very low. Like I believe Spain does not tax wine, but tax beer, and it depends. But at least there is a lot of coverage. A lot of countries are using alcohol taxes Sugar-sweetened beverages, not so many. It's fewer and more recent in most cases. So we'll talk a little bit about some of the Mexico and the European countries that have introduced. Just quickly to show that this is data for the Ukraine, increased their alcohol tax, and therefore the line that goes down then up is the price. Well, yeah, prices, inflation adjusted, and then we have consumption. Now Ukraine's a pretty big, this is spirits, it's a pretty big vodka drinking area, and even there we see a decrease. Okay, there is one caveat here that that's legal sales. So I'm not going to make any statements beyond that, but in any case, legally, we see the usual shape. And these are a couple on soda consumption. They're not the best. It's just to show that there is, even before we've done much with trying to increase price by increasing taxes on sodas, that the percentage change when prices go up in sodas, consumption does go down. It's not tight around that line, but does seem to be some relationship. We need, and there is better research on this. This is just the relationship between soda consumption and obesity by countries. It's not very recent. It's at least 10 years old, but it does, and again, it's fairly loose, but we still can see that higher consuming tends to have higher levels of obesity. So let's talk about some of the actual cases. Mexico introduced a sugar-sweetened beverage tax in 2014. It is 1 peso, that's only 5 cents, but prices are cheaper there per liter. It's all sugary drinks except yogurts and milks. So there's no minimum levels, any sugar added drink. What we have seen is a 6% drop in 2014. But what's even more important, without changing the tax, they've continued to see a decrease. Another 8% in 2015, and first half 2016 looks even higher. Purchases of bottled water have increased. So it's good to see that we have, well, at least 2.5 years data, and it's continuing to fall. And I'm going the wrong way. Okay. Portugal, we have 1 year data on them. They introduced the tax in last year. And like most of these that are new ones, it's two tiers. We have over 8 grams of sugar per milliliter is one rate, and less is a lower rate. In the first year, they collected 80 million euros. And they used that to decrease health service debts. And that's, we'll see, there's more of these that use that for health purposes directly. Their current efforts are targeting reformulation of products. Now, this is a difference with tobacco as well. There is, the industry reformulates tobacco products all the time, but it is not for health reasons. It is to get around regulations and sell more. Whereas with food, things can be improved by decreasing types of fat, amounts of fat, sugar, salt. So working with industry to reformulate is a different and probably a good thing with the food industry, where it is not with the tobacco industry. Okay, recently, UK and Ireland. Ireland was going to do it at the same time, April 1st, but they waited for EU ruling on that was positive. So they went ahead 1 month later. Again, the 2-tier rate. Over 8 grams is the higher rate in both, and under 5 is not taxed. So it's anything over 5 grams per 100 per milliliter, sorry. In Britain, they announced this, they said it was coming 2 years ago, and they found that about 50% of the drinks on the market had been reformulated to get to a lower tax level. Again, when cigarette companies do this and make a cheaper cigarette, for whatever, however it's formulated, that's not a good thing. Here it is a good thing. If we can, the lower the sugar we can get is a good move. Revenues in England are being used for physical education, after-school activities, and healthy eating initiatives. In Scotland and Wales, they will decide what to do. They each decide separately. And in Ireland, it was just May 1st, very similar rates. Looking back a little bit, France has had tax on sugar-sweetened beverages since 2012, fairly low. My information was that Parliament passed a higher rate for more than 11 grams, but it is not enforced yet. Hungary has had a comprehensive tax, sugar-sweetened beverages, sweets, chocolates, energy drinks, alcohol pops, salty snacks, since 2012. I've spent 2 years in Hungary. They have absolutely wonderful snacks and salty things, and so I can see why they needed to do this, because it's good, but not very healthy food, some of it. They made a lot of money. First 4 years, they've collected 200 million euros, and they've used those to increase salaries of healthcare workers. Again, it's going towards the health sector. Which is just the last couple slides on using health taxes for specific uses. As economists don't like earmarking, and neither do public finance people, because it limits government's ability to allocate funds. So I came into this field saying, no, earmarking is bad. I've come around because one main thing, and it matters a lot, is there's a lot more support for these taxes if people know how it's going to be used. And that has been, there was one case, there was this tax on grocers in Scotland, which only lasted 2 years. They were selling alcohol and cigarettes, but it was not used for health. So there's no, I mean, maybe it was not very well planned in the first place, but it might have been more popular if people had actually seen it went to what it was sold as going to be helping. This is just, I'm going to skip this. There's different forms. There's what we call hard and soft earmarking. It can be done any way. Some countries that we think of, like France, has actually soft earmarking. Most of the money for tobacco taxes goes towards health, but it's not enshrined in law. It's an obligation they see, but it's not in the law. And also there's all kinds of, there's things like Victoria Health, there's foundations, there's Thai Health that work on health initiatives. It's all kinds of things that are done and all the way money can be allocated. But we are seeing more of this even in Africa. Cote d'Ivoire has 2% of, an extra 2% tax on the same base as tobacco tax for let's say in French, the fighting tobacco, for tobacco control and for AIDS. Two last slides on Philippines, because they did a remarkable set of reforms. It is a 5-year plan to drastically increase taxes on alcohol and tobacco, so they called it sin taxes. They're a beer drinking country, so you know, but they still, there was a lot of support. The main purpose was to get money for universal health care coverage. That was for behind. So they had a 5-year plan of drastic increases in taxes, and also changed the structure from multiple tiers to a single tier, so going to the best practice in the type of tax. Big increases in alcohol. Most of the money came from the tobacco, but big increases in alcohol tax as well. And 80% of that incremental revenue, which is another important thing on using the funds for purposes. It's easier to have it be new revenue than to take money away from someone else, or the perception of that. With universal health care coverage, and it has now means that 15 million families that did not have it before have universal health care coverage. It was extremely effective and very popular. They finally reached the highest rate last year. The blue bars are the tax level. So the first year it tripled, and by 2016 it still went up more. It was like 5 times. Huge increases in taxes. And the other line is you see after pretty much not much change, and then a big drop in consumption. Revenues are still increasing. Eventually enough people will quit smoking to have revenues fall, but we're not seeing it anywhere. The worst case is flat at high levels, like in UK and France, and as they start increasing, that will go up again. So not really conclusions, but some final thoughts, that increasing taxes, and along with other measures, has proven in tobacco to be extremely successful in bringing down consumption. And it also increases revenue, which gives the governments more money for other purposes, particularly health purposes. Alcohol taxes increases have also been used in a lot of countries, or continue to be used, and we're seeing more of both of those being dedicated to particular purposes in health. Sugar-sweetened beverages are newer, as far as at least our experience, on a broad base, but the role of signaling to producers and working with producers to make food, processed food, healthier is something that is important, and also we're seeing some early successes in decreasing demand. Thank you.